Welcome everybody. I can see I got 39 participants in the room. Really welcome to you all. It's really good to know that people are really interested in finding out about Avon and Wiltshire Positive Behaviour Support Network, but also about community of practices as a whole. So what I'm going to do today is going to introduce myself and to give you a bit of background about me. I'll also be telling you a bit about one community of practice in general, which is the Avon and Wiltshire Positive Behaviour Support Network. I'll tell you about our journey to present day. I'll share with you some of the things that people have found valuable about attending the networks. And if I'd encourage you to find your own community of practice, but if you haven't got one, I'll kind of give you some hints and tips about setting one up. I'm not an expert, but I'll give you some hints and tips about setting one up, about from my experiences and from being involved in the Avon and Wiltshire Positive Behaviour Support Network. Before I move on though, is there anything else you're expecting from this workshop?
No, not that anything different I was expecting. That sounds good to me, Bev.
Okay, is there anybody in the groups, but would they like anything else from the workshop? Would like me to add anything else in?
Anyone else who's got any questions or particular areas that they'd like covered during the session? Then you're more than welcome to put your hand up and I can unmute you, or you can type into the chat.
No, well, there'll be an opportunity to ask questions at the end if people want to ask questions at the end too. I just wanted to make sure that those in the room were going to get what they wanted out of the session, really. Okay, so I'm Bev Cole. At the moment, I have been for a little while now, a couple of years now, a commissioning tutor for Bespoke Consultancy in Education, better known as BCE quite locally. We're based in the southwest, however, my role takes me across the country. So I've been delivering level 5 commissioning for wellbeing training in Liverpool, in Stoke-on-Trent, in Northampton, in the southwest, to various local authorities and health. I also deliver training to providers, and the providers are increasingly taking up the commissioning for wellbeing training because they are looking to be more knowledgeable about the kind of commissioning environment and how they can contribute positively to supporting that environment. But also, as we move forward in commissioning, the trusted provider status is becoming more apparent and more kind of a desirable way of working for some local authorities. So actually, by doing the training, people get that trusted provider status and understand that environment, their new environment they're working in. But that's behind all of that, and for many years I've been very keen advocate of positive behaviour support for many years, and too long to mention because I'll give my age away, but for many years I've been involved in that. And what I'm talking about today is kind of like the involvement I've had in the Positive Behaviour Support Network. That network started in 2010, and I'll tell you a bit more about that in a bit, but it's about that commitment to that network and that commitment to positive behaviour support. So I've got lots of experience. So I worked for many years as a provider in provider services, in senior management, and supporting people who communicate through their behaviour, but also setting up services, supporting people moving from assessment and treatment back into the community, and using positive behaviour support as an approach that supports that. So I've got lots of experience of those kind of things, and kind of can share some of those stories a little bit later. And that's my background in positive behaviour support. Hopefully that's enough about me for now. So I'm going to go on to tell you a bit more about Avon and Wiltshire Positive Behaviour Support Network. So it was, as I mentioned already, it was a network that's kind of set up in 2010. And it came about by a number of people already interested in positive behaviour support in individual organisations. And actually finding that they needed to extend that further. They were already providing individual training for their staff teams, but that there was a bigger picture. There was an area picture that kind of wasn't being addressed. And so a group of people got together and thought, actually as an area we could share a lot of this learning. So there was very large providers in the area that could afford to provide lots of positive behaviour support training, and there were also smaller providers in the area that actually couldn't afford to do that, but actually really did want to work in that way. And there was a kind of movement, it sounds quite dramatically, but there was kind of a movement towards making sure that everybody across an area, across the southwest at that time, or across Avon and Wiltshire particularly, which encompassed Bristol and North Somerset and some of Somerset, actually to work in a positive behaviour support way. So that's how the network kind of started, really, with that premise that actually let's make the area, the support for people who communicate with their behaviour in this area the best it can be. And how we do that is we're going to set up a community of practice, and we're going to share that knowledge. So those people that got that experience, those people that are large organisations, small organisations, private organisations, charities, actually share the information that they have and the positive effect that positive behaviour support can have on supporting people who challenge. So our goal was about that commitment to sharing knowledge, to sharing skills, and to other people and other agencies. Any questions so far, Hannah?
Nothing so far, Bev.
Okay.
Keeping an eye though.
Thank you. So our network was set up on on PBS Values, and I'm sure everybody in the room understands what those values are. But just to recap on those, it's about adopting non-aversive approaches. PBS is about making sure we are promoting positive behavioural changes in services and organisations that support people with learning disability and challenging behaviour. But it's bigger than that, is that there's other people that can benefit from positive behaviour support. Our focus in our neighbour in Worldshire was about learning disability, but actually that it's been evidence has shown that positive behaviour support is benefiting from all different people. And again, I'll give you some examples from my experience a little bit later on, but it's about promoting positive behaviour change. It's about using person-centered approaches, and it's about viewing reductions as a challenging behaviour as a secondary achievement. But actually the main achievement is about positive quality of life gains, positive outcomes, focusing on achieving positive quality of life and those things that we all kind of aspire to, and developing support that's based on a functional analysis of behaviour. So understanding that premise that all behaviour has a function. Actually, as the person got the skills and knowledge to be able to communicate what they want from their behaviour by using the preferred method of talking, but maybe not. Actually, it's about developing the support and understanding what that function, that behaviour has for that individual, and addressing that and the support around that person, and not expecting that person to change. And it's about focusing on relationships, building, and it's about focusing on relationship building. Okay. So again, back to the network. What was the purpose of the network? What we're going to achieve? What was our aims? What was our terms of reference? So we did really want to identify opportunities for promoting positive behaviour support in Avon and Wiltshire. We wanted to do that. We wanted to make sure that there was a greater understanding of positive behaviour support. So it was at a time, bearing in mind this started in 2010. So we've evolved since then. We've moved on. We've moved on with the times, as you say. But in 2010, actually, people were saying, we do positive behaviour support. And actually, when you looked and talked to those people that were doing that, actually they weren't doing positive behaviour support at all. They were doing something that kind of may have looked a bit similar, but it wasn't positive behaviour support. So we wanted to create that understanding. This is positive behaviour support. This is what it should look like. This is what you could be doing or should be doing. This is how you want it. We want to sort of share that what truly positive behaviour support was. We want to make sure that that was not just individuals that were doing that, that organisations were doing that a whole organisation would take on an approach of positive behaviour support. So when I worked for in the provider service, actually my role was about that. It was about making sure internally we had all the strategic policies and procedures and ways of working that meant that we were the whole organisationally we were looking to positive behaviour support, and it was about the network, was about sharing that, about getting that across other areas. So it was about supporting opportunities and having problem solving, so people could come, people people in their nature are complex. People who challenge are more complex. So actually it was about making sure that, you know, that people who had difficulties and that, you know, that they were able to find a way of sharing that difficulty, that people around them would be positively helping them, support them, and problem solving with that in a way that was a positive behaviour support approach. So that was the purpose of our network. That's what we want to achieve, and we still want to achieve that. We've those terms and conditions and those terms of reference, so they haven't changed over time. Actually, we still need to do that. We still find people say, "Oh yes, I work in a positive behaviour support way," and then when you actually unpick what they're doing and saying, actually, it isn't positive behaviour support. So we still need to do that. There's a bigger commitment to do that. We started really small, and actually the network has got really large. And that's not just about the people that are delivering the training, but that's those that are going and just being there and experiencing that workshop that someone's done. So we wanted to provide a programme of events that supported all the above, and we didn't, we formed a steering group, and we maintained that steering group, but what we didn't want is all presentations being done by the steering group. That would have been really limiting. That would have been limiting to the experience of those that were doing those presentations and their knowledge and skills. So what we do is that we make sure that the attendees have an opportunity to say, one, what they would want to be presented. You know, what topic would you like to be presented, you know, in the future? And then we find the most appropriate person to do that. I mean, it does mean getting hold of your networks and your contacts and you're saying, oh, you know, I think you'll be amazing to deliver this particular asset. Please, could you deliver it for us? It's all free. To keep the attendance is the sessions are free. We're given the rooms for free. And people present for free. So it's about kind of getting that kind of commitment from people that they do and do that program from, and that means that we meet the purpose of our network. Okay, so how do we make that happen? We've chosen to do a monthly monthly sessions. So our sessions are kind of like a presentation and a workshop afterwards. So rather than someone sitting and listening to somebody else talk, they get an opportunity to get involved in some way, and some of them are really, really involving. I remember one where it was looking at the sensory processing, and actually what somebody did was brought loads of noisy things into the room, really noisy things into the room, and allowed people to play with the noisy things and experience them. And some of that was great, and some of that was lots of tactile things, but actually some of that was great, but not for everybody. So there was people in the room that really wanted to leave quite quickly. And it was just about creating that sense of this, what it might feel like for somebody who's got sensory difficulties. And so we need to appreciate that, and we need to take that into account. And not everybody in the room liked this, and everybody was different. So it was a really powerful way of demonstrating that. And actually, behind that, they put they did a presentation about the kind of ways to help people, ways to support people in that in positive behaviour support. So we've moved online. That was a bit of a challenge, I have to say. Whilst I teach online and it's been fine, we didn't have a platform. So we used the sort of 40-minute Zoom call, which was brilliant. In theory, we thought that would work out well, and the presentation itself went really well. But the actual platform, the using of Zoom at that time for that group of people was a disaster, I must say. Somebody had to come in early, and therefore the Zoom call started. Early, and then we had 40 minutes, and that was then chopped down because somebody was in early, and then we were getting reminders all the time that the session was about to finish. It was a nightmare. It just really wasn't that great of a platform. We've learned from that. It was a bit of a rocky start online, but we've learned from that, and now the online sessions, one of the groups paid for an online a Zoom package, so that's available to him all the time now. So we got as much time as we like. We can natter on as much time. There's no limitations to what people can do. There's no curtailing conversations, which are really important. So that's really good. So as I say, it's just a rocky start online, but that's now worked itself out. The people who attend are providers, or carers, or family members, professionals, CRDs, social workers, student nurses, doctors, a whole range of people. Sometimes we're amazed by the kind of people in the room, both when we were doing face-to-face sessions, but also online. We've got kind of the people were desperate to come back online. So we did have a pause where we kind of weren't sure whether people would want more sessions at that time. We weren't sure whether actually, because everybody is dealing with the pandemic and the kind of consequence of that and the difficulties of that, would they really want PBS network to go ahead and go? So we sent out an email to people that had come regularly, and absolutely they've gone, absolutely yes, we need this support, we need something else, it isn't an easy time, we need this extra support, we need it. And so that's when we went online. And as I say, first one was a bit rocky, but the rest of them are okay. So we've talked about autism, we've talked about mental health, we've talked about active support, functional assessment, sensory processing, connection with nature. The list is massive. So later on I'll share a link with you, and we've got a website which is I'll share that link with the group, and you can go there and you can access any of the past presentations that we've done. So what people do when they present for Avon and Wiltshire Positive Behaviour Support Network, they share their presentations, and everybody has that. And all we ask is that, one, you don't change the presentations, and two, you acknowledge where they've come from. And that way more people can present. They can find something that's really good that somebody else has presented and present it themselves, and that's okay. So we also have a Facebook page where there's things on the Facebook page that you can access as well. So these things are available to you. So I'd suggest go look for them. So what do people say? Well, there's a whole range of things that people have said on the screen there. All of it really positive. Well, there have been times when negative. So we knew we weren't our rocky start online weren't too good because people told us so. They were like, the presentation, the content was great, but actually the platform was really difficult. It made it really challenging. I couldn't get in. It all felt like it was being rushed and curtailed. So we changed that. We took that on board and addressed that. And as they would keep it free. So this is just a snapshot of what people say, that we've got every session, every workshop, we ask for feedback, and we provide the feedback and we give that feedback to whoever's presenting. But also we look at that in terms of what, how can we make this improved, how can we develop this further in terms of our network, and how can we make sure it makes what is right for people. So we encourage people who come to the network, to the events, to say what they would like to see, to say what they would like to have in the future, and we do our best to incorporate that in the future. We encourage people who come to the events to say, if you've got something passionate about, you want to share it with everybody else. Let's hear it, let's share it, let's do a presentation, and if you need a bit of support, we'll give you that support to do that. But yeah, please share your best practice with everybody else. It's really important. So I've got a couple of links here, but maybe you've got, there's other, Avon and Worldshare Positive Behaviour Support are just one of the many networks that exist. I've been involved in a number of networks, and I'll tell you a bit about that in a moment. But it's just one of many networks that exist. There's a couple that I've put on here, but actually, could you just spend a few minutes now, just if you're aware of a network, could just put it in the chat box. Can you make sure that any network that you're aware of goes in the chat box, and then everybody else who's in the room can know what's around. They might not know something exists. People don't know even in Worldshare Behaviour Support Network doesn't exist, and it's been going since 2010. So just make sure you know it exists and pop those. I'll give you a few minutes to pop things in the chat box now.
That's a really good idea, Bev, because like you say, people aren't necessarily aware that there's things going on in their area. And I know we got a few people from outside of the Southwest who are sort of in attendance. So yeah, if there's something that you're aware of that might be useful to someone else who perhaps is nearby, then yeah, it'd be useful to share. I for one obviously know that there's a Plymouth PBS network that I think have been a little bit more hindered by COVID perhaps than Avon and Wiltshire, because they were quite newly established. But yeah, there's certainly a really good Plymouth network in the sort of Devon area.
And the other thing I would say is, if you're aware of a network, be involved in some way, whatever that is. You do. I'll talk about the steering group for Avon and Wiltshire Positive Behaviour Network in a bit, but actually just being involved, just people attending, just attending the events. There might be we advertise what the events are, and it might, you might not be interested in September event, but you might be interested in October event. But go to what interests you, because that's what you'll take away. You'll take away the learning from that. You'll take away things that you can use in your own services for that, and people and share with other people, and be involved in whatever way you can. If you're passionate about something and you've got something to share, and it's positive behaviour support, just share it. That's how we learn from each other. That's how we can be inspired by each other to move things forward, is by sharing those stories, sharing that press point.
I think that's one of the biggest things, actually. One of the biggest benefits of being part of a network or attending a network, even if it isn't every time it's run, is that sort of that peer network that you establish, finding out what people working for different organisations, or maybe sometimes in different fields, what ideas they have, the approach that they use in sort of implementing PBS. It's really useful to make those connections, isn't it? And sort of maintain those. So yeah, really beneficial.
Yeah, absolutely. So one of the last sessions I did was a session on wellbeing, and some of those comments that were in the previous slide were about what people felt about that, and the focus was on the wellbeing for carers, really, them not just moving away the focus that for a time from people supported to people who care for people who are supported, and actually looking at kind of wellbeing from their perspective as well, because if their wellbeing's good, actually the people they're supporting, their well-being will be better too. So it's about kind of taking that, and a lot of people in that group felt that actually, yes, I've forgotten my well-being. I've been so concerned about making sure in this pandemic, making sure that other people's well-being is met. I've forgotten my own, and I'm feeling a bit tired, or I'm feeling a bit worn out, and I'm really anxious about what the kind of situation's holding. So people benefit from that. You also benefit from connecting with others. So not just connecting about a subject, but actually you might find something with somebody else and say that they've said as part of the conversation, not as part of the presentation, and you make those connections. Say, can I catch up with you at another time and find more about what you've said, because that'd be really of interest to me, and I could use that within my work, that sort of thing. So I really recommend that. So I'll give you a few minutes to pop things into the chat box. Hopefully there's some things in the chat box, Hannah, with other networks. If not, just carry on and put them in at the end of the session. So as a network, we've also, and I just put a selection of the things that we've produced here. We've got a whole list of things that we've produced as a network, but these are my favourites, so sorry about that. I've picked those out. So one of the things we developed was a good practice guidance for use of restrictive and non-restrictive physical interventions, and we did that in an accessible and non-accessible version. What was really important to us at that point was that people who received restrictive and non-restrictive physical interventions actually understood what they should expect, what it should be like, what it shouldn't be like, and what their rights were and how that should be done. And so we developed that good practice guidance around those, so that people could understand that what if they needed physical restrictions, that actually what it should look like and how it should be, and when it should and shouldn't be used, and that they had a right and could say so if that wasn't how it should be. So and I think that's really powerful in terms of enabling people to talk about, this is what's going to happen and why it's going to happen. And actually somebody with a right saying, okay, I want this to happen, I don't want that to happen, I understand this, I understand that, I understand this is just about at a time when I need support to protect myself or others. So we developed a website, which I will put the link in the chat box at the end. So we've developed a website to go to. We've also got a Facebook page, which is really interactive, and possibly used more than the website nowadays. And the other thing that I really think of, one of the things, as I say, we've produced a number of things. This is just a little selection. I think I'd be all day telling you about what we've done otherwise. But the induction toolkit, so I've picked things that have made a difference to people. So the website made a difference because people can just access the presentations that have been done and use them, and use any of those kind of resources that are there, which are really excellent. And there's some toolkits there as well. But the induction toolkit, that was aimed at making sure that anybody new that came into a service, until they got a full positive behaviour support training, actually on day one they could start to understand what positive behaviour support was and what it meant to people, but understanding it from their own perspective as well. So the toolkit made people look at themselves, look at when they were challenging, because we all are, we all can be. Look at when what look at why they were challenging. Look at the effect of that and what they did, and what did they have other means to express themselves at that time, and then they so look at themselves and then look at the people they're supporting and kind of make those comparisons about kind of how the quality of life gains might be changed if you looked at positive behaviour support. So that's really important, and that in the first week of someone's induction, that was making a big impact. So it's really good thing to share. Again, all of these, all of the good practice guidance, all of the toolkits, they're all on the website. So please help yourself. So I've got a couple of links here for the Facebook page and for a link from Build resources to even the Worldshare website and some of the resources that were available. Again, I'm assuming that you'll get the presentation at some point. If not, I'll make sure it's in the chat. So I just wanted to make sure that you had that. I won't test the system by using the link. Have we got any questions so far about Avon and Worldshare Positive Behaviour Support Network?
None have come up in the chat, just sort of something that's jumped into my head. Who do you generally have attending? Is it a whole range of people from sort of support worker right up to, what's your general audience? That's out of interest there.
So I think what tends to happen, so everybody's welcome. When we put out the flyers, we say is anybody who supports anybody who communicates to their behaviour, and you'll note on the title we've used challenging behaviour. We tried incorporating communicating through their behaviour in all of our promotion, but actually people got the wrong idea of what we were doing. They just didn't quite get that language, so we had to change it to practice language that people are familiar with and kind of can understand. So it's open to anyone who supports somebody who communicates with their behaviour, really. And we have families, we have providers, we have people who use services themselves sometimes, and I think the audience is usually dictated by the type of presentation. So it's about where people join or go to network events where they kind of feel that they want to listen to that presentation or part of that workshop. So some workshops create more direct care staff, other workshops create more managers. So it's that, but we have a range of people all the time, and we're always surprised about the differences, the different people that we have attend.
Brilliant. And Annette, I'm assuming that's Netta, Annette. I don't want to call you Netta if maybe you aren't, but she's asked, what's the length of your training sessions?
So the workshops, they're always on a Friday, and they're always 9:30 till 12. And that's including a break. So we make sure there's a break so that people not only can have a bit of a break, but also so they got the chance to talk to somebody else that they're in the room that they may not have talked to before. It's surprising who you're just striking up conversations with the person next to you, what you can learn and how you can connect with people. And a lot of people have connected at the networks and then moved on and have greater connections afterwards. So yeah, we make sure that that time there is in there.
Brilliant. Thank you very much, Bev, and hi, Netta.
Any more questions?
Annetta's just added she thinks it sounds great and quite informal, which is good. And I think the informal nature is probably quite important, isn't it? It makes people feel welcome and.
Oh yeah, absolutely. We do our best to keep it informal. We do our best to make everybody welcome. Everybody's got something that they can share. Everybody's got something they can learn. And actually, the more we do that, the more welcoming we can be, the better it is for everybody concerned. And if someone's new to positive behaviour support or new to a role and don't really understand it, then there's somebody in the room that'll help them with that. So whether that's one of us as a steering group, there's always a steering group member at any presentations, because obviously we don't do them all ourselves. But any of those people that attend are always willing to share and be keen to do that. People are very proud of being part of the network, so actually they're keen to share the benefits of that with us.
Lovely. Thank you, Bev.
Okay.
Yeah.
Nothing at the moment. Excellent. Okay, and how am I going for time?
So we're 12:21. So yeah, you've got about 9 minutes.
Okay, good. Okay, so I just wanted to touch on.
Siri's talking to me. Sorry, sorry, my watch was just talking.
Oh, what was it saying? So 12:21. Okay, so I just wanted to touch on. I'm expecting that there's going to be a lot of networks that are in the chat box. If there isn't, I'll make sure I gather any information I have and I'll put it on the end of this this slide to make sure that you're aware of networks in your area. Just let us know where you're from and we'll find something. If there isn't something, actually, I can see a huge benefit in creating your own networks. As I say, we've been going since 2010. We've had various different people in the steering group, and we've had various people in and out of the network at different times. But the steering group has kind of maintained a pretty good core, and actually there is a lot of commitment to that. So I'd focus on the steering group if you're and who's in that as part of that process. So you need to really set one up. You need three things you need to focus on. You need to focus on the domain, the area of interest, and the key issues. So being clear about what it is your terms of reference are, being clear about what you're looking to do, what you're looking to achieve, and sticking to that. So I think there's quite a few times that we've had people that wanted to join the steering group or wanted to be part of the PBS, but actually they wanted to take it into a different direction. They didn't want to stick to PBS values. They wanted to include other things, and actually we're quite firm to saying, no, this is what it's about and this is how we want it to be. We want everything to be about positive behaviour support and all that elements of that's such a massive area. There's so many things that can come under that. We just make sure it does come under positive behaviour support so that we're not taking things into a different direction. The community, you talk about the relationship you build for the discussions, and you want people that are kind of going to share that. They're going to share. You want people who've got that shared interest and how that can be in the community and who that is, and who wants to be involved and how they want to be involved and how they want it to be set up. So we've evolved our network in terms of what people want from that, and and how they want it, when they want it. That's something that's been a community discussion about, and those relationships about. Let's build it, let's make it a community of practice, but let's make it work for everybody, not just for us who are kind of thinking that there's a good idea to set it up. And it's about that body of knowledge, stories and tools and developments. And as I was saying already, as a network, we've got a steering group, which is really important to have. But actually, it's about using all of our contacts, all the people we meet. We meet somebody in a session that's new. We kind of find out what it is, what's their passion, what can they bring to the network next time. And looking at the kind of that knowledge, stories and sharing and tools and how those are developed and what they're going to do and how they're going to do that. And we ask groups about if we've got something we think, oh, this might be a good thing for us to look at as a strategy. And we ask people, we have a network event saying, this is what we're thinking. What do you think about that? Is that something that's going to be useful to you? You'll see here, you need a Tracy. You do need a Tracy. So we've got Tracy Cox in our steering group. We've got various people. We've got learning providers. We've got a family carer. We've got a UE lecturer, and we've got me as a commissioning tutor. Although when I joined the network, I was working as a provider, and then I worked as a commissioner, and then I'm now a commissioning tutor. So kind of I've stuck with the network for all those things, changes in my kind of career directions, and for various reasons my career change has gone through. But you do need a steering group, and you need people who are that as a core of people that are going to commit, and there's a lot of commitment to make sure that you're kind of keeping on top of what's happening, keeping on top of what people want, keeping on top of that communication. So you need a Tracy. You need a Tracy. The Tracy does the, come on, we haven't done this. Come on, we need to do that. Come on, we need to ask this. Have you done this? Have you done that? You said you do this. Who's going to do that? So you need a Tracy. You need someone that's going to keep you going and keep you focused on what's going. And without a Tracy, it kind of wanders a bit. So when Tracy's been busy, we wander a little bit. So when she comes back in, we're more structured and more organised and lead that forward. So you do need to, Tracy, you do need to sort of, we have a plan of a rolling program of events, and I haven't mentioned that we do conferences as well. So we do biannual conferences. One of them has been Let's Talk About Jargon, and another one has been about workforce development. So we do conferences where, again, we bring people together up for the day, and they are really well received. We promote the Avon Worldshare network within Avon and Wiltshire, because that's the area we're working in, but as you just need to connect that further. And we support communication between members of the network, and we also share good practice, good data and resources, and create those. So just a bit more on that though. The one thing about this network, it is free. It's free to attend. We keep it free. It is a bit of a barrier to keep it free, but we do keep it free. When I was a commissioner in a local authority, I wanted there was a need for a network in that area. They didn't have one. It was too far to go to the other network. Some people from that area were attending the Avon and Wiltshire network, so I created one. But what I didn't want it to be, I didn't want it to be a commissioner-led network. I wanted it to be a provider-led network. So there was that call for providers to be involved. That listed a huge number of providers. But actually, as we got through to saying what we wanted to do and what we wanted to achieve and how we wanted to achieve it, people naturally dropped off. And then we had a smaller steering group, which was too big. And then when we started allocating tasks and people doing stuff, people dropped off again. And then we ended up with a core steering group of people that were committed to doing that. And they set up that network. It was in early stages when I unfortunately left that local authority, and they did try and keep it going, but I think the pressures of their individual jobs didn't keep it going for as long as they would have liked. So that there's still but that passion there, and I think it was about 6 to 8 months that we managed to get that moving and get that going. We got a free the college gave us a free room, and we had a better room because it was being really successful. We were drawing people into the college, and they were looking at other things. So it was a mutual benefit. So it's all kept free. It was definitely provider led. And when I as a commissioner, when I was asked to introduce things into the network meeting, I wouldn't introduce it. I'd say I'll take it to the network steering group, and I would take it to the steering group. They would choose whether that was in there or not. And that was difficult at that time, because as a commissioner, expected to do this, and I chose to do this, but expected to include things that the local authority wanted me to include at that time. So we're continuing to go online. We're continuing to look at research options. We're continuing to do annual conferences, and we support other networks. So the network I set up in Somerset was supported by the Avon and Worldshare Behaviour Support Network. They did a couple of presentations for me to get me started, to get people to know what it is and how it was done.